Good morning, good afternoon, good evening, everyone, depending on where you are connecting us from. Welcome to the global launch of the FIPWiSE Toolkit for Positive Practice Environments for Women in Science and Education. Thank you to those for joining us live today, and thank you to those who will be watching this recording afterwards. My name is Nilhan Uzman. I'm a pharmacist trained in Turkey. I'm the global lead for education policy and implementation at the International Pharmaceutical Federation, FIP. I am leading the FIPWiSE initiative. FIPWiSE is FIP's initiative for women in science and education to empower women in these areas so they can achieve their fullest potential. Also to attract students and young women into the fields of science and education. Today, let's stand up for practice and positive practice environments together with FIPWiSE. Next slide, please. I would like to warmly welcome our speakers and our chair, whom I'll hand over to shortly. We would like to know who is with us today. So please let us know by typing into the chat box from which country you are joining us from today and which area you are practicing as a pharmacist or as a pharmaceutical scientist, whether you're a pharmacist student or friend of a pharmacist. Thank you for joining us today. Next slide. Before we start, I would like to share a couple of logistics with you. This webinar is being recorded and live streamed via YouTube at the moment. The recording will be available on our website, events.fip.org. You will have the opportunity to ask questions to our speakers today through the questions Q&A box. And you're welcome to provide any feedbacks to us from webinars@fip.org. We would love to hear your thoughts. And this is an opportunity for me to invite you to become a member of FIP through visiting our membership application webpage. Next slide, please. So today we have a full and exciting program where you will explore the key factors that enable positive practice environments for women in pharmaceutical science and pharmacy education, with transferable learnings across the entire pharmaceutical workforce. You will learn about practical solutions for professionals, for yourself, for employers and policymakers in creating positive environments in women in pharmaceutical science and pharmacy education. Together, we will discuss how to take actions and stand up for positive practice environments with hearing your questions to our speakers. Please also join the conversation on your social media throughout this event with the hashtags provided: positive practice environments, FIPWiSE, women in science, or women in education. We'd love to hear your thoughts about today's launch event. Next slide, please. So that's all from me. Today's Global FIPWiSE Toolkit launch will be chaired by Professor Claire Thompson, who is the chair of FIPWiSE and who is also the CEO of Agility Life Sciences. Now I'm pleased to hand over to our chair. Over to you, Claire.
Thank you very much, Nilhan. It's an absolute pleasure to lead this initiative and to be with you today. Thank you all for joining. Next slide, please. So we're going to start off with some opening messages from the FIP President and the FIP CEO. Then we're going to launch straight into the FIPWiSE Toolkit. Part one will be an introduction to the toolkit itself. Then we'll have reflections and perspectives from Women in Global Health and FIP Equity RX. Part three will be providing practical solutions to establish positive practice environment and achieving the campaign. And then we'll wrap up at the end. But just a thanks from me to begin with, and I will thank all again. This is a phenomenal piece of work. You will just see an aspect of what has been achieved in a very short time. With a collective of fabulous people who have helped to put this together. We have some of those voices on the line today, but I want to personally thank all of those who have contributed to this. This was set out to be a toolkit to enable women in science to flourish, women in science and education to flourish within the workplace, but actually this provides a phenomenal and groundbreaking toolkit to enable us all to be in an environment in which we can succeed. So I truly believe that this is a toolkit that has broader perspectives across the entire workplace. Next slide, please. And just to pause and reflect, yesterday was International Day of the Girl Child. I certainly celebrated that with my daughter. And today is a very special day, not just because we're launching the toolkit, but because our very own Nilhan has a birthday today. So congratulations, Nilhan, and thank you for all of your phenomenal insight and input.
Thank you, Claire. Thanks, everyone. It's such a nice gesture. I'm pleased, and it's great to be with you all. Thank you very much.
Next slide, please. So again, this is a list of all of the contributors and authors of the toolkit. You see that we have global perspectives here. I want to personally thank the supporters within FIP Exco and also the Bureau. We've felt and we've heard your support throughout the generation of information for this toolkit. And also, as we launch this toolkit, we feel your support, and we very much appreciate that. So thank you to all who've contributed and continue to help us with this initiative. Next slide, please. So I want to hand over to Dominic Jordan, the FIP president, for his remarks. Dominic.
Thank you very much. Happy birthday, Nilhan. And greetings from my pharmacy in Switzerland, dear colleagues. It is my privilege to join you today at the virtual launch of the FIPWiSE Positive Practice Environments for Women in Science and Education Toolkit. The toolkit builds on the World Health Professions Alliance Positive Practice Environment campaign, which FIP has pledged to support. As FIP president, I am proud that our federation is presenting you with this toolkit. It encompasses the efforts of our FIPWiSE working group, authors and contributors, and the FIPWiSE team from all around the world. It is also highlights the need for and raises awareness of positive practice environments for women in pharmaceutical science and pharmacy education, and for the entire pharmaceutical workforce. A positive practice environment enables the recruitment and retention of employees, supports the delivery of high quality work outcomes, and benefits society as a whole. Moreover, science and education benefit from gender diversity, given that safe and positive practice environments are provided. There are already inequalities in science and education, and COVID-19 has increased their likelihood. As the global community fights COVID-19, the productivity and scientific output of female academics have been disproportionately affected, leading to a loss of women's scientific expertise from the public realm. Employers should be mindful of these disruptions and adapt their workplace policies in response to these challenges. The COVID-19 pandemic has brought us face to face with the importance of the need to ensure safe and purposeful practice environments for all. We have seen that manufacturing specifications for medical personal protective equipment, PPE, are usually drawn up based on the male body. For example, surgical masks may be too large to fit women's faces, increasing their risk of infection. During the pandemic, there have been many reports of PPE that is not designed for women's bodies and physiological functions. This puts women not only in science and education, but across all health sectors in unsafe working conditions. Containing the spread of COVID-19 will depend on effective measures being accessible to all, including women and girls. A shadow pandemic has struck women who have been the first to lose their jobs and who have experienced increases in unpaid work. Some have experienced increased intimate partner violence. In low-income countries, disruptions to maternal and reproductive health services have increased maternal deaths, unwanted pregnancies, and unsafe abortions. Women who have caregiver responsibilities have been put in the position of having to choose between their professional and personal lives, without proper work-life balance policies. Growing poverty has forced girls out of school and into child marriages, which represents a huge lost opportunity to bring women and girls into science and education careers. Although progress is being made to increase women's involvement across different areas, we know that women are still underrepresented in science, technology, and education. Our federation launched the FIP Workforce Development Goals in 2016, and they expanded their scope in 2020 with the launch of FIP Development Goals. Now, there are 21 goals that address developmental areas across the entire pharmaceutical workforce in science, technology, and education. In particular, FIP Development Goals 10, Equity and Equality, is the foundation for all the other goals. We can't achieve the remaining FIP development goals if we don't address the inequalities in the pharmaceutical workforce. And for that, we need to address the issues around practice environments for women in pharmaceutical sciences and pharmacy education, and for the entire workforce. Building on the work of FIP Development Goal 10 and FIP Equity RX, FIP's leading campaign for championing women in global pharmacy and health, our new FIPWiSE toolkit, is the first toolkit to describe and identify key factors for positive practice environments through a pharmaceutical science and pharmacy education lens. I am proud that FIPWiSE or FIPWiSE toolkit will demonstrate a proof of concept to the pharmaceutical workforce on positive practice environments. If you are an employer, a professional, or a policymaker in science and education, your work starts today to enable positive practice environments by implementing this toolkit into your context. The toolkit will give you solutions and ways forward to do that. Together, it is our collective responsibility to enable positive practice environments for women in pharmaceutical sciences and pharmacy education, and the entire pharmaceutical workforce. FIP is committed to support you all as you implement this toolkit with trust, solidarity, and action. I will ensure that FIP will be reporting progress on FIP Development Goals 10, Equity and Equality, and on the provision of positive practice environments at the Health Ministers Summit led by FIP in 2023, so we can support the achievement of the UN Sustainable Development Goals in general. I am delighted that the FIPWiSE toolkit is being launched during my presidency. I extend my sincere gratitude to the authors, to the contributors, and to the FIPWiSE volunteers for their exceptional work. And thank you to my WHPA and Women in Global Health colleagues, and to my FIP Bureau members for their support for positive practice environments. Let's stand up for positive practice environments together. Long live FIPWiSE, long live FIP.
Thank you so much, Dominic. One of the key aspirations of the FIPWiSE group is to engage, enable, and empower girls and women to give an environment in which they can achieve to their fullest potential. And one of the key factors in that is actually having men as allies. I think ally is not really a strong enough term. It feels quite passive. I think men as advocates, and I want to publicly thank you for being such an advocate, not just for the FIPWiSE initiative, but for women in the workplace. Thank you. I want to hand over to FIP Chief Exec, Catherine Duggan, for her reflections. Catherine.
Hello, Claire. Hello, everyone. It's a delight to be with you all today. Thanks so much for inviting me. And as Claire mentioned, yesterday was the International Day of the Girl, so this is very timely. And of course, today it's Nilhan's birthday. Happy birthday, Nilhan. And it's certainly a special day with a special launch that will always be remembered by you. So the title of my mini set of words today is that FIP stands up for the World Health Professionals Alliance Positive Practice Environments campaign. It's really important that we learn from each other, share with each other, and adopt and adapt. It's a philosophy at FIP that we would enable our colleagues, no matter where, for using good work that exists, of course with permission, but so that we build on everything. So colleagues, in our working lives, the places we work are as important as the people we work with and the job itself. When an environment is supportive, enabling and collaborative, we can all thrive. And when an environment is neither all or none of these, we can deteriorate. And our productivity, along with our well-being, can suffer. Even during COVID pandemic, we saw so many of us unable to enter our usual work environments. We adapted our online communities and our ways of working, and this was essential to ensure we thrived during the past 19 months. For employers, ensuring an environment that supports individuals is a key way to enhance and sustain productivity. I would argue, as a CEO, it's not a nice to have, it's a must have. You need to enable your colleagues to have a good environment to work in. And one of the biggest benefits of being a CEO in a federation such as FIP is the ability to collaborate and grow alliances, to grow friendships and mutual work for the benefits of all. I draw upon three such alliances. The first of all, FIP being a founder member of the World Health Professions Alliance, WHPA. WHPA brings together the global organizations representing the world's dentists, nurses, pharmacists, physical therapists, and physicians. And the Alliance speaks for more than 41 million healthcare professionals in more than 130 countries. The WHPA works to improve global health and the quality of patient care and facilitates collaboration among the health professions and major stakeholders. It's really important for us in pharmacy to be able to collaborate, network, showcase and share across our other professions. Since becoming FIP CEO in 2018, I've actually benefited hugely from working with the CEOs from the 4 other health professions. In my previous roles, I'd always worked with individual practitioners from different professions in practice, but having the global perspective alongside the global perspective I need at FIP, this has really helped. And upon reflection, it's helped even more during the pandemic. Many of the initiatives we've been focusing on since I joined FIP suddenly came into their own. Their relevance was heightened because of the pandemic. One such program of work was this positive practice environment, the PPE work. Of course, colleagues, since 2019, PPE has taken on a very different importance as a shorthand for personal protective equipment, a vital mainstay of all health professions. But the WHPA PPE program became equally relevant and essential as the months progressed. Some very practical and feasible lessons were initiated for us all, from understanding the strengths and weaknesses of the workplaces. Take Dominique today, working in his community pharmacy, all the way through to our hospital pharmacists, those working in industry or in academia, all the way through to many of our colleagues in the WHPA working in hospitals, general practices, or out in community. Organisational climate and working conditions were under scrutiny alongside celebrating success. We want to support effective strategies that promote resilient and sustainable health systems to joining with others, raising awareness and building alliances to make change and ultimately make a difference on the ground. In an interview in this toolkit, Howard Catton, 2021, the current WHPA chair and the CEO of the International Council of Nurses based in Switzerland, recommended leveraging existing relationships with international organisations to raise the visibility and the profile of the need for positive practice environments This seems so timely as we consider the implication for the WHPA's PPE campaign across FIP. The second alliance is friendship and mutual work, for all of which I draw upon, is that we have forged and consolidated with our colleagues in Women in Global Health. In the interview in this toolkit, Dr. Rupa Dutt, Executive Director of Women in Global Health from the US, emphasizes we do not need to fix women to fit into systems and policies modeled on men. Instead, we need to fix the discriminatory systems and cultures that put obstacles in the career paths of women. As I mentioned, we've been a member of the WHPA, but in addition, we've been a member of the World Health Organization, the Women Global Health Workforce Network Gender Hub since 2018. And together, we're all striving to fix systems that do not serve women through addressing gender equity and diversity inequalities in pharmaceutical practice, science and workforce for us at FIP. Enabling positive practice environments for women in science and education is our attempt to do as such. But as Claire mentioned right at the start, while we focus our work on women in science and education, many of the points raised in the toolkit are applicable to us all, and that is true equity and equality. So the third alliance I draw upon, colleagues, is the FIPWiSE Women in Science and Education. The FIPWiSE is an initiative that has grown from a need to support and enable women across all stages of their career in all areas and sectors of science and education. This group emerged from the Pharmaceutical Workforce Development Goal, number 10, Gender Diversity and Balances, which highlighted the disparity across science and education in terms of women in leadership roles. And these actually are visible, or should I say, invisible to us all. As the work on the FIP development goals built on and extended the PWDGs, Goal 10 expanded as well to reflect all elements of equity and equality issues across all demographics. Actually, these have been brought into too sharp a focus during the pandemic, and they include age, ethnicity, income levels, disease states, and gender, to name but a few. The place of FIPWiSE has become more secure and focused FIP minds on creating useful, practical and essential spaces, places and resources for all women in science and education. With the fundamental aim, though, that these are not limited to women, but available to all. What we can do by shining a light on FIPWiSE is to expose some issues that may be applicable in some way, shape or form to everyone in our profession. It also seemed essential to consider how the work of the WHPA could be supportive of emerging findings that environments across science and education were not always positive, not always nurturing, not always supportive and enabling. Neither were there tools to hand to support the women in the said workplaces to find a way through. So the WHPA's PPE campaign was adapted to the needs of the FIPWiSE community. Through the alliance forged by the 5 professions, the supportive campaign on PPE for all across all workplaces seemed ideally placed to support our initiatives for women in science and education, but ultimately to benefit all across the pharmacy profession. Sometimes the useful tools we develop in one area can support another area where the need becomes apparent, and a further alliance is created. As fundamental as the 17 UN Sustainable Development Goals are to us all, we know that creating the environment for sustainable development is key if we are to flourish, even more so following a pandemic. And following a pandemic, as we take time to find our place in the world and our work, we will need tools and toolkits that can enable, support and empower us, especially when the environment may be less supportive and less positive as we would like. Creating alliances from existing alliances during a time of such crisis feels very important. We know that actually forging our relationships during this time has taken efforts, but have reaped benefits. And the forward of such a collaborative toolkit is a very good place to acknowledge the strengths of alliances, the power of collaborations, and the benefit of support FIP is proud to facilitate. Congratulations to all authors on this toolkit, which I personally know will prove of value to all who use it, and take it forward in their practice, wherever that may be. I look forward to the event, and thanks a million for having me. For now.
Thank you very much, Catherine, and thank you for being your inspirational leadership, your vision and your relentless support, not just for these programs, but ensuring that every member of the workforce is supported and is an environment where they can be the best that they can be. Okay, part one of our session this afternoon is the introduction to the FIPWiSE toolkit, and then we will pause for some reflections on what you've heard and some questions perhaps for the speakers. Next slide, please. So I'm going to pass over to Aisu. I won't do her justice by introducing her, so I'll allow her to introduce herself and then talk through the toolkit. Aisu.
Okay. Hello, Claire and everyone. I am Aysu Selçuk, FIPWiSE Toolkit Project Coordinator and FIP Educational Partnership Coordinator. I am also a woman in science and education as a lecturer at Ankara University and a scientific advisor at TPA. Next slide, please. I would like to share drivers, purpose, and content of the FIPWiSE Toolkit for Positive Practice Environments for Women in Science and Education today. Building on World Health Professions Alliance's Positive Environments campaign, FIPWiSE Toolkit for Positive Practice Environments for Women in Science and Education was developed to identify and address inequalities in the workplace environments which affect women in pharmaceutical science and pharmacy education. The toolkit is designed to raise awareness and provide possible solutions for individuals, employers, and institutions that can enable positive practice environments for women in pharmaceutical science and pharmacy education. As Dominic mentioned, it is the first toolkit that describes and identifies factors from a pharmaceutical science and pharmacy education lens. Next slide, please. The toolkit is a digital toolkit. It is going to be publicly available for everyone. Following the foreword from FIP CEO and preface from the FIPWiSE chair, the toolkit includes interviews with World Health Professional Alliance and Women in Global Health. The toolkit includes 4 chapters aligned with its purposes. The first chapter of the toolkit is about drawing attention to and understanding the issue of positive practice environments in education and science. While focusing on the need to create positive practice environments in education and science, this chapter highlights the workplace inequities and inequalities faced by women and how these have been amplified through the pandemic. Next slide, please. The second chapter delves deeper into 5 key factors. Factor 1, equal incentives for equal work. Factor 2, work-life balance. Factor 3, creating supportive and safe working environments. Factor 4, opportunities for professional development, recognition, and empowerment. And Factor 5, women in leadership. These factors are developed based on the possibility to improve positive practice environments for women in pharmaceutical science and pharmacy education. A total of 13 case studies included in the 5 factors so that real-life examples and recommendations can be demonstrated from various institutions and countries. In the third chapter, it provides the way forward messages for each factor to individuals, employers, and institutions. For the fourth chapter, it provides various media materials such as campaign poster and social media cards for each factor. Everyone can support positive practice environments for women in science and education while sharing them in their social media accounts. Various initiatives for women in science and education were also mentioned in the table in this chapter. Now I am handing back to you, Claire. Thank you.
Thank you, Aisu. Belma, can you talk to us a bit further on drawing attention to and understanding the issue?
Thank you very much, Claire. I would love to. So these days, COVID-19 pandemic has brought us face to face with the need to ensure safe practice environment for all health professionals. And in order to achieve health workers' well-being and general safety, it is of crucial importance to establish positive practice environments across the healthcare system worldwide. Now, WHPA has launched initiative Stand Up for Positive Practice Environment, and they have defined it as a healthcare settings that support excellence in decent work condition, and it has the power to attract and retain staff, provide equal care, quality care, and to deliver cost-effective, people-centered healthcare services. They have also defined factors that are needed to achieve positive practice environments, such as professional recognition, commitment to equal opportunities, healthy and safe work environments, increased opportunities, professional training, and career development. By implementing such factors, we have then ability to have improved performance and professional self-worth of health professionals, the ability to remain healthy, motivated, and efficient in working environments, and benefit the society as a whole as developing more productive health workers. Such establishment of gender equality represents one of the 17 United Nations Sustainable Development Goals, as well as one FIP development goals, and it has the ability to provide equal treatments, rights, and obligations, as well to provide equal opportunities for both genders according to their needs, and also to improve organizational performances and reputation, which leads, after all, to the improvement of national productivity and economic growth. Unfortunately, gender inequalities are quite represented today, and they are present in different parts of organizational structures, practice, and education. There are multiple forms of gender inequalities at workplace that affect women's position, empowerment, and career advancement. Now, although men are being outnumbered in global pharmacy workforce, women are still lacking leadership role and decision-making positions. Now, this is considered a step backwards from establishing a gender equality working environment. Direct discrimination against women in pharmaceutical profession is seen through the gender pay gap, as female professionals tend to be paid less and obtain lower status position than male professionals. Although significant increase is marked at appointing women at position of assistant or associate professor, women in pharmaceutical education tend to be less appointed at the high rank population and higher academic leadership position. Gender gap also occur in number of published papers, grants, recognition awards, and speakers' invitations. Research have also shown that women and men are not provided with equal opportunities for career growth, and due to the fact that women acquire less co-worker support and receive less of the opportunities for involvement in mentoring programs, trainings, and networking. Lately, there are several initiatives, organizations, and programs that are created in order to support equity and equality for women in education, science, and practice. Here you can see some of them, and there are a list of tables in the toolkit where you can see the whole list of such organizations. Institutions and leading organizations should offer guidelines and strategies to promote fair treatment and equal opportunities, which will now result in establishing positive practice environment, because inequalities, gender inequalities in workplace are far away from being just statistical imbalance between men and women. They represent the biggest challenge on local, national, and global level. It is of crucial importance to raise awareness of gender inequalities in pharmaceutical workforce, and therefore to develop strategies to improve gender equity and equality. Now, in order to achieve this equality in healthcare workplace environment, urgent actions are needed with continuous recognition and acknowledgement of women in healthcare and in pharmaceutical profession. The delivery of efficient and safe healthcare workplace environment depends on the competencies and workplace environment of health professionals. And in the conclusion, to achieve global goals based on quality care and quality workplaces, implementation of positive practice environment is required on national level. Thank you very much, and back to you, Claire.
Thank you, Belma. Next slide, please. So delving into the specific aspects of the toolkit, there are 5 key factors which underpin positive practice environments, and we're going to discuss those in order today. So factor 1, equal incentives for equal work. Factor 2, work-life balance. Factor 3, creating supportive and safe working environments. Factor 4, opportunities for professional development, recognition and empowerment. And factor 5, women in leadership. You can't be what you can't see. Next slide, please. So we're going to kick off with factor 1, equal incentives for equal work. And I want to hand over to Eshan, who will discuss all of the aspects in factor 1. Eshan.
Thank you, Claire, and happy birthday, Nilhancığım. Hello, everyone from Turkey. First of all, I should say that I'm so excited to be a part of this meeting, and I'm honored to be a member of FIPWiSE and to contribute to the writing of this toolkit. To begin with, I would like to say it's known that all kinds of discrimination, including discrimination based on gender, reduce the motivation of employees who are discriminated against. At the same time, prevention of this gender-based discrimination will affect the quality of the job, the expectation from the job, and the future of the job, which means the health of the people directly when it comes to health professions. Gender inequalities in pay are often assessed through an indicator known as the gender pay gap. The gender pay gap measures the difference between male and female average earnings as a percentage of the male earnings. Overall, features such as differences in educational levels, qualifications, work experience, occupational category, and hours worked account for the explained part of the gender pay gap. The remaining and more significant part, the unexplained portion of the pay gap, is attributable to the discrimination, conscious or unconscious, that is pervasive in workplaces. While the gap has been gradually closing over the last decades, there's still a substantial gender pay gap in many countries, ranging from a few percent to over 40%. In Turkey, it's 20%, according to my calculations from official numbers. There's a gender pay gap in every country. That's the knowledge that we all can be sure. But the concept incentive is not limited to wages or only closing the gender pay gap. So please let me define what we mean by incentives shortly. Next slide, please. The previous one, please. Okay, thank you. Incentives are important means of attracting, retaining, motivating, satisfying, and improving the performance of employees. Incentives can be applied to groups, organizations, and individuals, and may vary according to the type of employer, as well as each professional's preferences and motivators. Next slide, please. Incentives can be financial or non-financial. You can see some examples for the financial and non-financial incentives here at the slide. And all this may seem too complicated to listeners or readers of the toolkit. And at the same time, implementing these incentives requires developing a goal-oriented, holistic strategy. For this reason, in this section of our toolkit, we wanted to make suggestions about what can be done in practice. Next slide, please. In this slide, you can see our suggested actions in the section to perform gender-sensitive incentive policy. First of all, performing regular pay equity analysis is one of the most effective tools to close the gender pay gap. Second action that we can suggest is determining equal value. That means independently assessing the value of each job and ensuring that the process is free from bias. Creating a fair reward system is another yet important tool for incentives. And promoting pay transparency can also be seen as a communication cord. And industry-wide comparisons should be used. And for last words, we are sure that there are many suggestions to add to these. We have written to open this discussion a little more, to make the topics we put forward to be thought about, and to develop them while putting them into practice. And I hope it will be helpful to the reader. And thank you so much for listening.
Thank you very much, Eshan. We'll move on to factor 2, work-life balance, one that I'm certainly not very good at. Dalal, can you walk us through work-life balance, please? Thank you.
Thank you, Claire, and happy birthday to Nilhan as well. Thank you, everyone. Good evening, good morning, good afternoon. I am very pleased to be among this inspiring group of women in this launching of the FIPWiSE toolkit, and it was a pleasure to participate to this toolkit and to work on work-life balance. Next slide, please. So actually, how do we define work-life balance, which is the second factor in our toolkit? By definition, work-life balance is the ability of an individual to meet their work commitments as well as other life commitments, including activities and family work with minimum conflict of role. So actually, work-life balance is not to distribute assets and requirements equally among the different requirements of life, but rather to be wise and to be reasonable in distributing this balance and in making the things which matter most come first. Actually, society has double expectations for women. So besides the normal and substantive family requirements, also the society requires women to participate and to take role in life. According to literature, studies have shown that women are at least 30 times more stressed than men, and especially women who work full-time and who have children under 13 years of age. The causes of stress come from life itself and the different requirements and commitments, as well as from work and from the being worried over financial status. So actually, what are the causes of work-life balance? We're going to see what are the most common triggers in the next slide. So actually, there are numerous causes that demote the possibility of work-life balance, and these include conflicts, mainly between family requirements and the requirements of science and career, especially for women who work in research or in academia and whose commitments require much long time, which is not perceived by the society. The second cause might be the type of our gendered systems, where in many societies there is an inequitable structure within institutions that promotes men and definitely does not really give the same promotion to women. So it is a framework of gender inequity sometimes, which could make women sometimes more liable to suffer a conflict in their work-life balance. Also, many institutions, unfortunately, do have lack of support for women. So this includes insufficient mentoring, lack of psychosocial support, the lack of a complete framework or a formal modality of flexible working hours, and also because especially in health sectors, women are sometimes underrepresented in terms of leadership and decision-taking positions. It is, of course, noteworthy that the COVID-19 and the unprecedented situation has exaggerated different roles for women. So the unpaid labor and childcare, as well as home duties, have been exaggerated during the pandemic as a result of the lockdown and the induced distancing. And women in science and education have actually more suffered from additional requirements of work-life balance during the pandemic. Moreover, and with the current technological advances, workers are available round the clock, and this will reduce the time which is available for women in science and education to pay for their families. Next slide, please. Our toolkit explains how do we promote a change in the area of work-life balance and how do we make it more practical and more possible. So actually there is no magical solution, but rather it depends on the incentives which are taken by the individuals as well as by the institutions. So individuals, women in science and education are advised, according to our toolkit, to build downtime in their personal calendar when they are busy and when they are unable to commit to work requirements. Also, women are advised to work smart and not hard. And this means that women should purposefully and reasonably locate the required work instead of work which consumes much time and energy without being rewarding. women are also invited to have quality time, actually vacations and disconnection, exercise, meditation, family commitments, and family occasions are well deserved by women and their families. Talking about institutions, in fact, a gender-sensitive culture at an institution with a family-friendly type and which is supportive for women and which pays attention to their gender inequalities and to their requirements based on their reproductive capabilities, and which enables them to stand forward in work and for research and in research is quite supportive. Also, institutions should adopt senior appointments for women and allow them to take decision-making and leadership positions. This does not all work except if we do very good public advocacy for the role of women, and if we explain to the public that the reproductive role and the role of being a mother should sometimes be balanced with the role of research, academia, and science, which is really time-consuming. In the next slide, we're going to see some of the case studies that highlight work-life balance from our toolkit. So colleagues from Denmark actually have explained the Danish model in terms of a complete framework that states that the allocation of opportunities and positions in work should be based on qualification and should never be based on gender. Other colleagues from Singapore who have represented the pharmaceutical regulatory workforce as well as community pharmacy workers have commented that family care leave, and this is different from maternity leave, it's a family care leave, and it should be devised by institutions and should be done or should be in debt to females, regardless of whether or not they have children. Also, productivity is not measured by the number of hours behind a laptop or a computer, but rather by quantitation and by key performance indicators. Also, the current availability of pharmacy outlets and different shifts can make the life of pharmacists, especially female pharmacists, appear easier and better. Finally, my colleague from Turkey, Eshahan, which has just given us an account on factor 1, has nicely contributed to factor 2 by saying that during the pandemic and contrary to all sectors, the health sector, and this includes women as well, has not stopped and the working hours were incredibly increased. The absence of another adult caring for the children during this time has caused serious problems for women in science and education. So actually the final take-home message from factor 2, and which we can take from scientists who have worked for decades on the issue of work-life balance, is to not confuse having a career with having a life. Thank you.
Thank you, Dalal. I think that is certainly advice that we can all take on board. And the pandemic really has shone a light on the imbalance between caring responsibilities and also the fact that women are, for the most part, involved in either activities or roles that are undervalued. Let's move on to factor 3, creating supportive and safe working environments. Next slide, please. I'm going to hand over to Alison for this one. Alison.
Thank you very much, Claire, and thank you, Dala, for that presentation on factor 2. I'm Alison, FIP Educational Partnership Coordinator, and it's a pleasure to have contributed to this toolkit on factor 3, which talks about supportive and safe working environments. Next slide, please. Okay, so a wise man once said, when people are financially invested in a working environment, they want to give returns to that working environment. However, when people are emotionally invested in a working environment, they want to contribute their best to that environment. A supportive and safe working environment ensures good mental health and emotional well-being of the individuals working in this place. In general, we have research has shown that a working environment determines the quality of work delivered, including the employees' productivity and performance. This research has also shown that women are more exposed to unsafe practices and circumstances at work. Such practices include violence, dysfunctional competitions, unacceptable working conditions, including bullying, insubordination, and insolence. Hence, it is of necessity to create safe and supportive working environment for women. This kind of environment will support excellent, decent working conditions and will have the power to attract and retain staffs. Achieving a safe and supportive workplace should be done intentionally. It should be done thoroughly, and of course, challenges would always come up. So it should be done with resilience. From the toolkit, some suggested actions to consider when planning to or creating this safe and supportive workplace includes, first of all, when preparing to create this safe and supportive environment at our workplace, there is a need to do some sort of root cause analysis, needs identification. The idea is so that you know the current situation of your workplace, if you're an employer, with regards to how safe and supportive the workplace is. Now, after you identify the needs, you need to lay the foundations on which you build this safe and supportive workplace. These foundations should reflect the guiding principles and value of your organizations. Some of these recommended principles from the toolkit shows that the workplace should promote a collaborative environment at work, building trust among colleagues and the institutions as well. So there's you trusting the colleague you're working with and getting support from them. And there's also a trust to the institution, the management, and the leadership. Then also very important is promoting open and supportive feedback mechanisms. After you lay these foundations using the suggested principles, we need to make provisions to sustain this safe and supportive work environment. Some of the provisions to consider is, are there adequate resources for the workers? Are there adequate resources for workers' health? Some resources to consider are resources for new mothers, policies for protection against occupational hazards, as well as resources that build staff development. It's really important for someone to know that in a place they work as a scientist, as an educator, as an academic, they are growing, they are enjoying career development, and the workplace is providing the support for them. Another provision to consider when trying to create a safe and supportive work environment is provisions against workplace violence. This could be regulations, it could be disciplinary measures, policies, and also educational interventions, especially against sexual harassment. And there should be a zero tolerance for things like these, zero tolerance for discrimination and other triggers of workplace violence. We also have that the employee's workload and performance should be considered. So the policy should exist in the workplace that are flexible and adaptable, keeping the capabilities of women in place, especially in the light of their health, I mean, mentally and physically. Next slide, please, Velma. So in this slide, we see that our colleagues from Singapore have shown us some case study of what are being put in place to ensure safe and supportive work environments. Examples of existing practices that provide this kind of support in a workplace could be team bonding activities, working, having initiative and activities amongst colleagues in order to understand each other better and promote trust between them. We also have that the leaders at these workplaces are well trained to resolve conflict amicably so that there are no misunderstandings, no miscommunication, and nobody feels offended. There is also a very strong emphasis on feedback culture, and every employee is encouraged to speak up when necessary. Some policies and actions that are in place for safe and supportive work environments include whistleblowing policy, where the staff can raise concerns about ethical issues or policy violation without the fear of being reprised or being made to feel like you've done something wrong. There is a mandate against verbal and sexual harassment, and there are official escalation protocol for this kind of issues if they ever occur. Some good practice intervention for this kind of working environment include providing staff with various courses for their mental wellness and resilience. Finally, from this case study, we got reflections that the starting point to create a supportive and safe working environment for women involves all level of practice, all level at the organization. And this includes how you do your recruitment, how you are hiring people without gender bias, the training of the staff that you recruit, training them on parameters such as integrity, equality, harassment, and stuff. I hope that you enjoy reading the factor 3 of this toolkit, which talks about safe and supportive work environment. And I'm happy to take any questions and comments you have. Thank you very much.
Thank you, Alison. I completely agree that safety within the workplace is the absolute minimum requirement. And we need to do everything that we can to ensure that policies are not just in place, but enforced. Deeds, not words. Let's move on to factor 4, opportunities for professional development, recognition, and empowerment. Isu.
Okay, thank you, Claire, and hello again. Next slide, please. Let's look at what is professional development first. Professional development includes all the training, certification, and education that an employee requires in order to advance in their profession. Why it is a factor? Because employees can gain abilities through professional development to become better and more efficient and grow in their respective fields. They are more likely to be retained and add significant value. If they lack a specific talent or the environment and support in which to grow, they will be less likely to stay in their job. For healthcare professionals, to keep them up to date with relevant, adequate, and reliable information, professional development strategies and programs are highly demanded. Next slide, please. Here are some good practice examples from the literature. The first example is Leadership Program for Women's Innovative Professional Growth. The research team provided knowledge, tools, and a supportive learning environment for women. After completing the program, based on the testimonials, 40% of the women received a promotion within the 12 months. So we can see the positive effect of such programs on the promotion. Another example is dual mentorship model of professional development for women working in healthcare. Perspectives from mentor to mentee were shared during 12-month period. Based on the researchers' conclusion, the model is promising in provision of an interdisciplinary environment and professional networking. It also contributes to career development, job satisfaction, and regional workforce retention. Another research group listed recommendations for creating professional development programs for women successfully, based on their questionnaire and interactions with the women. So here are some suggestions from the list: getting public and financial support, organizing meetings, discussing topics on women's professional development by focus group discussions, fostering a safe and supportive environment where women can share problems and seek advice. Next slide, please. So let's look at the highlights from the case studies for factor 4. We have 3 case studies from our colleagues from United States, Indonesia, and United Kingdom. The authors have and also suggest that one transparent system through HR department for registration of professional development programs, an allocation in the yearly budget for the programs, and such programs must provide opportunities for reflection, receiving feedback, and developing individuals or organizational goals. Recommendations specifically for women that they must not look down on themselves, must have confidence on contributing significantly at workplaces. Establishing equal opportunities must be employed because both men and women have career aspirations. Another group of suggestions are supporting women on regaining their confidence and focus not only on the working conditions, but also on returning from maternity leave. Moreover, social media announcements must be used to build an individual's confidence in their achievements and raises their profile for professional development, recognition, and empowerment. That's all I want to share for now. I'm handing back to you, Claire.
Thank you, Aysu. It's so important to recruit appropriately, reward, recognize, and it all leads to greater retention and greater confidence in our competence. Next slide, please. So our last factor, women in leadership. Next slide. And I'll hand over to Nisa for this one. Nisa.
Thank you, Claire. Hello, everyone. My name is Nisa, and I will briefly touch upon the last key factor that underpins the positive practice environment. It's factor 5, women in leadership. Next slide, please. It is important to note that the number of women completing higher educational degrees, such as bachelor, master's, and doctoral degrees, is increasing, and so is the number of women in the labor force. The proportion of the labor force represented by women increased significantly from slightly over 1/3 of all workers in the 1970s to almost 50% in 2012. Within the education and health sectors in particular, astonishingly, women comprise more than 75% of the workforce. However, despite the omnipresence in the labor force, women are often underrepresented in leadership positions. Barriers that impede women's representation in senior level positions include stereotypical gender roles that generate a viewpoint towards women as the caregivers and men as the breadwinner. Because of this, women may have to take a leave of absence from work, which could delay them from achieving higher level positions. Another barrier is the lack of leadership mentality. This mentality is characterized by inadequacy of early leadership engagement, which stems from a notion that women have insufficient qualifications or necessary skills to lead. The lack of representation that stems from stereotypical gender roles and the lack of leadership mentality consequently leads to a lack of mentors and sponsors. Without having role models of the same genders who are in leadership positions, women may think that being a leader is an impractical career ambition. So these challenges may impact career choice and trajectory for women in education and science. Enhancing work-life balance, early leadership engagement, and access to leadership opportunities are key actions to improving gender balance in career progressions. In terms of work-life balance, employers could create family-friendly policies such as sufficient paid parental leave and flexible working arrangement to accommodate shared household responsibilities. These policies would allow women to climb the organizational ladder while growing a family, preventing motherhood from causing a career setback. To tackle the lack of leadership mentality, creating professional development and leadership programs, especially at the beginning of their careers, would help build self-confidence in pursuing career aspirations to become future leaders. Lastly, access to resources and leadership opportunities would involve the creation of mentoring alongside sponsorship and networking programs. Having successful women as role models could inspire and empower other women to achieve the same or similar career trajectory. Next slide, please. There are 5 case studies in the toolkit that touch upon leadership for women in education and science. And these are some of the highlights from the real-life experience of our contributors. To sum up, according to the contributors, due to the traditional gender roles in which women are the homemakers, they believe that career shall come second after fulfilling their responsibilities at home, which create the social and organizational barriers that constrain career progressions. And on the right-hand side are some of the examples of policies and actions in their workplaces, which include creating non-discriminatory work culture. Such a culture means that employers should focus on qualifications, soft skills, and leadership quality of the employee, regardless of gender. In the Philippines, interestingly, they have laws that regulate discrimination, harassment, or violence against women, as you can see on my screen. Next slide, please. During the COVID-19 pandemic, our contributors pointed out that women spend more time on childcare and homeschooling than men do. And this situation leads to a double burden of full-time job and caregiving responsibilities, which cause women to feel burnout. In order to tackle this gender inequality or inequity in leadership, Professor Diantini from Indonesia suggested that it is essential to ensure an equal number of women and men are offered opportunities for every position, and that salary or remuneration should be given based on performance, not on the basis of gender. Professor Babalola from Nigeria designated a place in the university for nursing mothers to keep their babies with their caregivers while at work. Benosa from the Philippines stated the establishment of regular gender awareness training to train all workers, both men and women, to be more sensitive and responsive to the issue of gender equality. And last but not least, Dr. Halad from Lebanon mentioned the establishment of a health committee during the pandemic, which included female leaders to disseminate knowledge and debunk falsified information related to COVID-19. And that's the end of my presentation. Thank you so much for your attention. Back to you, Claire.
Thank you, Nisa. Such insightful contributions and feedback as part of these case studies. Next slide, please. So now we're going to pause and reflect on what you've heard as part of the toolkit. And we've got a little bit of time for some questions. So I think we've had one question that has come in around how does the environment affect patients and patient care? Now, the majority of the toolkit, we have been focusing on women in science and education, but actually we've had quite a number of the case studies where we've had input from frontline pharmacists in community or in hospital. So we've got a broad perspective of feedback, and I would encourage you to read each of those case studies. But in terms of patients, it's not just around frontline healthcare, it's about health outcomes and pharmaceutical science in terms of researching and developing new medicines. So I can certainly reflect on if we have more supportive, secure and enabling workplaces, that can only be of benefit to developing new medicines. My background's in pharmaceutical science, but also in having positive environments for patients. But I'd like to invite Dalal and Eshahan to perhaps feedback on their thoughts on how creating positive environments can have an impact on patients and patient care. Dalal, would you like to go first?
Yes, thank you, Claire. Actually, our toolkit was more focused on women in pharmacy science and education. However, I can say that whatever positive focus we have in the environment on women in general in any workplace, can apply to what we how we think about the environment when it comes to patients. So of course, a healthy environment, an environment of equality, an environment where everyone receives the care needed irrespective of gender or age or belief is a perfect environment for patients, I would say.
Thank you, Dalal.
Thank you, Claire. Thank you.
Eshahan?
I was about to say just the same thing with Dalal, so I have nothing to add. Can you hear me, Claire?
Yes, thank you. I think we're all echoing the same sentiment that this can only be positive for individuals in working environments, but also in patients. Do we have any further questions come through, Aisu?
No, Claire, we haven't.
Okay, in the interest of time, shall we carry on with the rest of the session? So we now move on to the second part of the session where we have perspectives from women in global health. Next slide, please. So it gives me the great pleasure to introduce Iris. Iris, I will not do you justice by introducing you, so I'd like you to introduce yourself, and then we've got a few questions on your work in women in global health. Iris.
Thank you. First, on behalf of Women in Global Health, I want to say a very big thank you for this opportunity to join you today. I'm absolutely delighted to be here with so many amazing panelists. My name is Iris Mwanza. I'm representing Women in Global Health. I'm the co-chair of the Gender Equity Hub, which is co-hosted by Women in Global Health and WHO. I'm also the director of the Community Health Roadmap, advocating for community health workers, among other things. So thank you again.
It's an absolute pleasure to have you with us today, and thank you very much for your support for our activities, in particular support for the toolkit. Could you tell us about the initiatives of the Women in Global Health in encouraging and enabling positive practice environments for women?
Yeah, certainly. As mentioned in your remarks and also in Catherine's remarks, so much of the discussion today and this toolkit is relevant for all women working in the health space. So Women in Global Health, as you know, is a network and a movement that is, and the work is being done every day by women in the global health chapters in 25 countries around the world. And this number is growing. So while I'll highlight just 3 of many overarching global initiatives, I want to recognize that much of the heavy lifting is done at the country level by these chapters. So the first initiative I want to highlight is the Gender Equal Health and Care Workforce Initiative, launched just this February with France and WHO. And the focus is urgent investment in safe, decent, and equal work for women health workers. As many previous panelists have said earlier today, this awful COVID pandemic has exposed more than ever that while women in health are undervalued and often unrecognized for their work, this work is critical for strong health systems and for global security. So this is really important. And I just have to thank FIP for joining us in this initiative. The second is Women in Global Health as a co-convener of the Alliance for Gender Equality and Universal Health Coverage, advocating at both global and national levels for gender equality to be central in UHC. I think we all know that UHC can't be achieved without addressing gender inequality and without ensuring women's rights and without recognizing and supporting women in the health workforce. And this includes a dire need for more women health leaders. I think we've heard a lot about that today, and I can't agree more. We've heard the oft-quoted number of 70%. 70% of the workforce is women, yet only 25% of women hold leadership positions. I mean, this is patently wrong. It's also wrong-headed, resulting in weaker policies and poorer decisions and worse health outcomes for all of us, not just women, for all of us. And the last thing I want to mention today is that Women in Global Health is co-host of the Gender Equity Hub under the WHO Global Health Workforce Network, or GWIN. And the work here is to accelerate large-scale gender transformation. You've probably already read some of the vital reports on the state of gender equality in global health, and several policy action papers that include specific recommendations for gender transformative policies and actions in women's leadership, in global health security, and so much more. I could talk endlessly about it, but I'll stop here and just ask anyone who's interested in more information and finding these reports and details. You can easily find them. Just Google Women in Global Health. Thanks.
Thank you, Alice. Phenomenal work, and there's so many synergies between what we're trying to do across each of our movements, and we can only do this together. We have some recommendations as part of our toolkit, recommendations for individuals, for employers, and for organizations, whether that's at national or international level, to enable and provide positive practice environments. I guess I'd like to get your insight into what recommendations you would have for individuals, employers, and organizations to create an environment in which we not just survive, but thrive.
Yes, I think one point that has come out today is that there are many different practice environments across the world, and one can find extreme variations even within a single country. So it's important to recognize that context matters, and the best resource is the women themselves working in that particular space and place. And this FIP, the FIP toolkit, is really an exemplar of how to get it done. And the fundamental principles and practices today, they really resonate and translate to any woman working in health writ large. And I would dare to say beyond the health space. I think any woman, any professional woman working can find value and help. I know that I'm preaching to the choir with this group, but I'll just say, if there aren't women in your environment to tell you what you need, then you should know, first of all, that you're part of the problem. But there are external resources, and I think this is an excellent resource to seek out help and to use it.
Agree completely. And we have a lot to do. And I'd like your insight on what success looks like. We count what counts. What should we be measuring? What should we be aspiring to? So what do you think success looks like in providing positive practice environments for women?
Yeah, I think as a start, equal representation in leadership is a no-brainer in this industry where we have a majority women. Ideally, we actually need to invert the existing pyramid of few women at the top and many women at the bottom who are undervalued, underpaid, and even unpaid work when we're talking about health and care work. So as you said, there's lots of work to be done, and we all need to keep pushing hard for gender transformative policies. So as I mentioned earlier, there are many sort of tools like the one we're talking about today that speak to specific industries. So what I'll share is some guiding principles, and I think you have also shared some, but from our perspective, I think there's a lot of overlap as well. But just very quickly to go over, some of these principles. I think first, to have a framework for gender equality, women's rights, and human rights. I think second, to challenge the privilege and power imbalances that exist to undermine gender equality. I think third, to analyze these challenges that face women intersectionally. So to look at race, ethnicity, geography, disability. There's so many other criteria, but it's important for these efforts to address the actual challenges that women face completely and comprehensively if we're going to be successful. And lastly, to state, and I think it's been said already, but worth repeating, work must be done by all leaders, not just women. We need all leaders to push for real transformation, for all of us to be healthy and for all of us to stay safe. Thank you.
Thank you very much, Iris. You know, to have equality across power, privilege and platforms would be phenomenal. And then for us to realize and appreciate that we need to use all of those things for good. So when we reach those upper echelons of leadership, that we create space for others to move into. Thank you very much again, Iris, for your contributions and your ongoing support. We love working with you.
Thank you.
Next slide, please. Okay, I'm going to hand over to Lena to talk about implementing FIP DG10, equity and equality. Lena.
Thank you very much, Claire and Nilhan and everyone. And again, happy birthday, Nilhan. I'm really pleased to be part of this landmark launch event. And it's quite hard to follow the amazing panel that's just preceded me. But I just wanted to emphasize a couple of things. FIP President Dominique Jourdan shared some important messages earlier about the impact of COVID-19 on women and girls in general. And this really makes standing up for positive practice environments more important now than ever. Catherine has also said this has simply become a must-have. And of course, Iris just emphasized the need to push hard for gender transformative policy. So it's really timely for the FIPWiSE toolkit to be launching. Just some background on the FIP development goals, and Dominique and Catherine have both touched on this, but the FIP development goals have been developed to transform global pharmacy by providing a systematic and integrated framework that can support the transformation of pharmacy practice, science, as well as workforce and education. And as Dominique has said, of the 21 goals, the one that probably crosses over all of them and the one that impacts us all is FIP Development Goal 10, Equity and Equality. This goal calls for clear strategies to address inequalities in the workforce, widen access and equity of pharmaceutical care, services and access, as well as equity and global capacity in pharmaceutical sciences development. The FIP Equity RX is FIP's program on equity and equality in pharmacy. It drives FIP DG10's global implementation and commits to its motto, pharmacy leaving no one behind. Through this goal, pharmacy wants to ensure equitable access to healthcare for all individuals, regardless of the following social, demographic, and health identifiers and their intersectionalities: age, disease and comorbidities, gender, of course, literacy and access to education, mental and physical ability, race and ethnicity, religious beliefs, sexual orientation, and socioeconomic status and class. The equity and equality goal, as all the FIP DGs, consists of 3 elements: workforce and education, practice, and science. The FIPWiSE Toolkit for Positive Practice Environments, launching today, is a unique example of an FIP product that can support the implementation of a goal across all of its 3 elements. Of course, it supports the implementation of several other goals. I'd like to say congratulations again to the FIPWiSE team on this achievement. And as ever, and joining my FIP staff colleagues to say we are committed to supporting our members to implement this toolkit and utilize the suggested actions in the toolkit to influence practice environments positively and swiftly. Thank you very much.
Thank you, Lena. Next slide, please. I think in the interest of time, we will skip the reflections and questions piece. And if we have time, we will come back to that at the end. Next slide, please. Let's move on to part 3, providing practical solutions to establishing positive practice environments and how you can support and activate the campaign. Next slide. So you can become part of the solution. Nilhan, I believe this is yours.
Thank you, Claire. Thanks. I was enjoying our presentations and the panel so much. Thank you very much for everyone's contributions so far. Building on what you have said, we also listened to what our authors have said, the case studies we received, and of course, we heard the voice of our partners like WHPA and the Women in Global Health. And we summarized all of these messages for you in order to become a part of the solution, so you can establish positive practice environment in your workplace for women in science and education, but as we always say, beyond that. And this chapter explains what kind of solutions you could use, whether if you're an employer or a manager. This applies to academic research institutions or pharmaceutical industry and other science and education related workplaces. So we have dedicated and tailored messages and actions for you. If you're a professional in pharmaceutical science and pharmacy education working in these areas, we also have tailored solutions for you. And for policymakers, the ones that are going to do the systematic change, we will also need the support for a big picture change, and those in governments, regional or national pharmaceutical organizations will benefit from the solutions provided there. So together with my team and Claire, we'll be taking you through the solutions for each factor. And the next one is the equal incentives for equal work. We are just giving you a brief of some of the solutions, but we'll invite you to take a look at our toolkit, chapter 3, where you will see various different solutions that may be applicable to you. So in this part, we invite employers and managers to ensure they have human resources planning and management for equal provision of recruitment, payment, and incentives. For professionals in pharmaceutical science and pharmacy education, we would like to invite them to consider proactively starting an equality department at your workplace in collaboration with HR and relevant decision makers. And for policymakers, as Iris, Catherine has mentioned as well, we need to develop policies and regulatory frameworks. So we need support from policymakers to have that frameworks in place, implementing evidence-based incentive systems, fair pay, and transparency policies, so we can ensure equal incentives are provided for equal work. I'm handing over to Aysu now for the next factor.
Hello, colleagues. Here are the key suggestions for work-life balance. For employers and managers, perform a survey at your workplace to understand its strengths and weaknesses, organizational climate, and working conditions, considering gender equity and the distinct needs of women and men. For professionals in pharmaceutical sciences and pharmacy education, take your full entitlements to breaks and holidays. For policymakers, establish family-friendly policies, considering different roles of individuals, such as being a professional and caregiver at the same time. More solutions can be found in the toolkit chapter 3. Thank you, and I am handing to you, Belma.
Thank you very much, Aysu. And for the part of creating safe and supportive working environment, the key messages for employers and managers are to adopt occupational health, safety, and wellness policies and programs that address workplaces hazards, discrimination, physical and psychological violence, and issues pertaining to personal security. For the professionals in pharmaceutical sciences and pharmacy education, to make sure you recognize issues such as bullying or harassment or symptoms of stress, and to find out about the steps to cope and where to go if you need help. For the policymaker, to facilitate research on positive practice environment issues such as bullying and harassment, and in order to provide evidence-based recommendations on interventions. Thank you. Hand it over to the next speaker.
And on factor 4, which is opportunities for professional development, recognition, and empowerment. So the advice we do give to employers and managers is for them to provide adequate resources, information, tools, and equipment to their employees so that they can do their jobs to the best of their abilities. And to those professionals in pharmaceutical sciences and pharmacy education, like many of us who are here, the advice we do give and is to stay motivated motivated to volunteer for and to proactively request for activities for professional development. Because sometimes when we don't get, because sometimes we don't ask. So just request politely and proactively for these opportunities. And to the policy makers, like we have already mentioned, we request our advice is to develop policies for career development and advancement. So I'll hand it over to the next speaker.
Thanks, Onyango. So in terms of women in leadership for employers and managers, we propose providing effective supervisory, mentoring, peer coaching programs and leadership training that is tailored for female employees, particularly at the early stage in their careers. For professionals, if you hold a leadership role, we would encourage you to become a mentor, a sponsor, an advocate, a coach, or a role model to women in science and education to provide guidance, promote and advocate for these individuals, and to create spaces for them to move into. And for policymakers, develop evidence on the impact of gender balanced leadership teams on business and organizational results. Next slide. Okay, I want to highlight the tools that are in the toolkit so you can support positive practice environments. You can use each of these hashtags within social media. The digital toolkit is already available. Here is the link and you can scan and go straight to it. Next slide, please. And I want to pass over to Nilhan and to Onyango to talk about how you can use the toolkit and activate the campaign.
Thank you, Claire. Next slide, please. So we shared some of the solutions with you, and we also wanted to explain how you can implement these solutions and how you can also activate the campaign, because raising awareness is an important step. So we want to support you with that. And we listed some actions in the toolkit, which I'm also explaining a brief here. So some of the actions that can support you in order to activate this campaign would be running workshops where you can educate your employees on the benefits of positive positive practice environment. If you're a policymaker or you have access to decision makers, you can encourage governments and other key decision makers to mainstream positive practice environments. This toolkit will give you the evidence for that. Next one, it's really important to engage with youth here, and as they are the future of the science and education. So you may engage with young members of the workforce to empower them as agents of positive change at local, national, or international levels. You may create a series of podcasts or webcasts, as we are in the digital age now, looking at each factor of this toolkit and how it applies to your workplace, your country. This could be another example for engagement on this topic. The next one is we have several case studies. I think it was 13, as Aysu has mentioned. These are real life examples, and they're an evidence base, explaining cases from different countries. So you may use these case studies or to your government to create positive practice environments. And finally, the next one, you can launch a positive practice environment best practice awards your workplace. These are some of them, and you'll be able to explore more in our digital toolkit, which I shared its link just in the chat. I'll hand over to Onyango again.
Okay, so you can also use the FIPWiSE toolkit by making use of our social media cards. Now, we all know how social media can really gain traction, for certain initiatives that we have. And so we have social media cards for you from the chapter 4 of our FIPWiSE toolkit. So we'd like to encourage each and every one of us to post, to share, to tweet them, and they come in form of factors. So there's a social media card for factor 1 up until the last factor. And then we also have a poster, so also to encourage you to print and to display this poster in our workplaces, just to encourage us and to remind us to really be champions of creating positive practice environments for ourselves and for the employees around us. Thank you.
Thank you, Anyango. And in the next one, again, in this chapter 4 of this toolkit, we are trying to activate the campaign by sharing initiatives, good practices from around the world. So we listed 25 initiatives from around the world on gender equity across different sectors, not only in science and education, but also in healthcare and pharmaceutical workforce in general. You can follow or engage with these organizations to amplify their efforts to enable positive practice environments. It's everyone's job to do that. So it's really important to form alliances, as Catherine has said in her speech. And if you already have an initiative, or if you will build an initiative after this toolkit, we would love to hear from you, and we would love to add your initiative in our toolkit. So you may reach us out from education@fip.org about your initiative on gender equity, women in science, or positive practice environments. We would love to have them listed in our toolkit. So that's all from us in terms of activating the campaign, and we would love to see your tweets, posting our social media cards, and tweeting the messages we prepared for you. And I'll hand over back to Claire to wrap up today's session. Thank you very much.
Thank you, Nilhan. I want to pause in case there are any burning questions that have come in from the audience. Aisu, is there anything that's come through?
No, Claire, we don't have any questions.
Folk are overwhelmed by the amount of information and insightful content within the toolkit.
Claire?
Yes?
Can I ask a question to Iris?
I think you can, if she's still with us.
Thank you.
Absolutely.
Yeah. First of all, thank you, Iris, to be with us today. And my concern is that only a few men were attending this meeting today. And we discussed that with Claire also in the previous meeting. What do you think, how could we involve men a little bit more in this fight against the bad environment we have today for women, and to be more active in the fight for equity? Because I'm sure confrontation, or if we ignore the other part and the problem that they have, will have no chance of success. If we are collaborating, I'm sure we will step by step move forward and have a solution in a few years, I hope. How could we, within FIP, or in a larger context, involve men a little bit more for this kind of goals that we have in FIPWiSE? Thinking that maybe the men are afraid because they feel they are excluded, what is wrong. They feel that they are accused because over decades they made the laws and so on, and at the end we have this environment today. And I would like to find a solution within FIP how we could have more men advocating for the FIPWiSE goals.
Thanks, Dominique. I think that's such a critical question, I think, for all of us. You know, we talk about allies, we talk about advocates, but it's so true when you look at who is participating and utilizing wonderful toolkits and, you know, sort of fighting for gender equality. It really is predominantly women, and we're not going to be successful if it's just us preaching to the choir. I'll give you sort of, I think there's a short-term answer and a longer-term answer. And I think the solution is a combination. But I think in the short term, we need to more actively engage other entities out there, other alliances, other organizations, big players in, for example, the health space. You know, we talk about, you know, the 3 Gs, the Global Fund, GFF, Gates Foundation, Gavi, I should actually call it 4 Gs. You know, I think we need to engage them actively so that they are participating not as a bolt-on, but as part and parcel of what they do and how they are going to run their organizations. I think in the health space, that will go a long way to really pushing gender equality in a real way. Again, also engaging with governments. I think we need to talk to governments, even the governments that aren't friendly, and this is where I talk about the longer term, to start to have that discussion, because the invitations are already going out. I mean, they are always invited, but very few attend. And then, people like you probably know men, of power in the health space beyond your own industry. So I think all of us have to push as far and as hard as we can beyond our immediate sphere of influence and try to engage them. And I think one of the wonderful opportunities that there are with the next generation and with the youth. My sense is there's big opportunities there that we're not taking full advantage of. We need to educate them from the beginning. We need to start addressing some of these societal issues, because what we are seeing reflected in the health space is really, it is a mirror of what's happening in society. So there's no easy answer, unfortunately. I wish I had a silver bullet, but I think, the work has to continue, and all the things that we're doing, we just need to keep doing it, but more, I think with more intentionality and not looking at it as a bolt-on or a nice to have. I think this is very, very fundamental to our long-term success. Thank you.
Thank you.
And just to touch on that, I'm a sportswoman, and we're certainly seeing initiatives in sport, primarily in football and in rugby, where men are starting to call it out. And there's hashtags and various different movements that are hashtag call it out or call him out, whether it's racism, sexism, inappropriate behavior. And I think those movements, if we can bring those further into our workplaces, will certainly help. But promoting that to those who are more aspiring scientists, aspiring researchers, aspiring pharmacists, or those earlier in their careers will certainly help. They are our future. And they can help us to shape it.
Thank you.
If there are no further questions, let's move on to the next slide. Velma, can we move on to the next slide, please? Well, it gives me great pleasure to bring this session to a close. I really encourage you to read through the toolkit, look at how you can put those practices in place in your working environment, how you can get involved in the movement and the advocacy within your environment, within your region, within your nation, and reach out to us where we can support you. As I said to Iris, we can't do this on our own, and we shouldn't do this on our own. The problems that we see, that we feedback through each of these different factors, are truly global issues. So we have incentives in place to encourage people to really embrace the change and drive for the change, stand up for positive practices. So thank you very much to everyone, not only that have contributed to this session today, but have contributed to the toolkit. And Nilhan, I think I'll hand over to you to finish.
Thank you, Claire.
Give you the last word, as it's your birthday.
Thank you, Claire. I really enjoyed today and learned a lot. Even though we worked on the toolkit ourselves, it was a very informative and inspiring session. As a woman in science and education myself as well, I feel empowered. I hope you are as well. And Dominique's question was very important. I think that's something that we will all look into, how we can make positive practice environments everyone's job and responsibility. So I want to thank everyone for their support. I'll just use this opportunity to share the link to our digital toolkit. Please take your time and enjoy and explore the toolkit, and we look forward to your engagement on social media. And if you have any questions, anything that pops up, or any initiative you would like to share for our toolkit, please contact us education@fip.org. We'll be waiting for your questions. You can also scan the QR code that you see on the screen to access to the digital toolkit. Please do share across your network. And the next slide, this is an opportunity for me to mention that we have many other work streams in FIPWiSE. The positive practice environments was just one of them. We have the confidence in competence work stream, where we are developing various resources in order to boost confidence, because it's really important for us to feel competent in what we do and in ourselves, so we can thrive. And we also aim to support youth, young scientists, educators, and students with several initiatives. So we attract more women in science, more women to science and education. I see our youngest FIPWiSE member joining us. Hello, Maya. Thank you for joining. I was looking forward to have her. And so this is the result of a FIPWiSE woman, a future FIPWiSE woman. And thanks Maya for being there with us. And of course, through FIPWiSE, our main goal is to support the achievement of FIP development goal number 10 through supporting the Equity RX program. And in the meantime, we are building our community. So you are more than welcomed to become the member of the FIPWiSE community. So we can use our privileges to reform systems that no longer serve us. And in the next slide, not last but not least, I also would like to recognize all the members of the FIPWiSE working groups. It's a powerhouse of volunteer women in science and education. And we launched this initiative almost 2 years ago, and the place that we've got so far, it's so exciting, and it just shows our potential and what we can do for women in science and education. So I want to thank each and every of them. And finally, in the next slide, let's close, and thank you very much for staying a little bit longer than expected. I would like to sincerely thank to our chair, Claire, and all of our speakers, our panelists, guests, my team members for an excellent session, and to you, of course. Without you, we couldn't have this wonderful session. To our participants for joining us from around the world. We look forward to see the butterfly effect of this toolkit in your countries. Let us know. We look forward to hear your initiatives in enabling positive practice environments for women in science and education. Thank you. Have a nice day, evening, afternoon. Take care. Bye-bye.